I'm Uday Pratap Singh. You're watching News X. Our big focus remains India's Omicron tally, which is steadily rising with fresh cases of the variant in Maharashtra, Rajasthan and Delhi. 7 have been reported in Maharashtra, 9 in Jaipur and a man in Delhi have been found positive with this variant, taking the total count in the country to 21. The 9 patients in Jaipur are from the same family and have recently returned from South Africa. Meanwhile, a woman and her 2 daughters who travelled from Nigeria, her brother and his 2 daughters in Pimpri Chinwad, a township in Pune, and 1 male who travelled from Finland have also tested positive for the variant in Maharashtra. Several states are issuing strict travel advisories for travellers. An expert government panel will be also meeting today to discuss booster dose amidst Omicron fears. Joining us at this point live is Aishwarya Jain from Delhi. We also have Abhijit Bhatt joining us from Gujarat. Abhishek Sharma is joining us from Mumbai. Abdul Bashir joins us live from Hyderabad. Let me begin with you first, Abdul. What is the latest situation as far as Omicron is concerned in Andhra Pradesh and Telangana? While new cases have been found, are the 2 state governments there on high alert?
See, as far as Telangana and Andhra is concerned, fortunately, there are no Omicron variant cases reported in both the states. But the number of international passengers arriving at the Rajiv Gandhi International Airport in Hyderabad is increasing. From December 1st till today, 1,270 passengers have arrived at the Rajiv Gandhi International Airport, among which 13 of them had tested positive. These 1,270 passengers were the passengers who travelled from at-risk countries to the city of Hyderabad. So 13 of them had tested positive, and as a sigh of relief, 1 passenger, a 35-year-old lady who had travelled from Britain, had tested negative to this Omicron variant, and results for 12 others are awaited. So the authority is on alert, monitoring is going on, and all the passengers who are arriving from these at-risk countries are under strict home quarantine. So these are the instructions given by the state government. Following of regular protocols is become mandatory. This people moving out in public have to wear their mask, that is compulsory, and carry their vaccination certificate. So if we talk about the preparations from the state government, then the state governments are fully prepared as per the authorities, be it the beds capacity, oxygen capacity, and vaccination numbers. So the state government had been stressing more on the vaccination numbers. However, the second dose percentage in the state remains low, but the authority is working on making people understand that vaccination is a must and everybody has to get vaccinated. So this is a situation where the authority, both the state governments are on alert. But here the point of concern is that the Delta variant cases have seen a slight rise in past few days. However, Telangana has reported 156 COVID positive cases in the past 24 hours with 1 death. And Andhra Pradesh has reported 154 COVID positive cases that are the Delta variant cases in the past 24 hours. Now here, no Omicron variant positive patient had been reported in both the states. So this is a sigh of relief for both the states. But however, the state government are on high alert. Yes.
Okay. Let me in fact also rope in Aishwarya Jain at this point from Delhi. Aishwarya, if we talk about the national capital, there has been 1 case now reported in Delhi. Is there contact tracing underway of this particular case? And as far as the other individuals concerned who are suspected, any confirmations on whether they have the Omicron variant or have the genome sequencing samples not yielded any results yet?
Well, as far as Delhi is concerned, the 1 passenger who have the travel history to Tanzania have been shifted to LNGP hospital, and the tracking has already been done by the Delhi government. All those people who are in touch have been admitted to LNGP hospital, which has been designated for the Omicron variant of COVID-19, and the treatment is underway. Currently, we are learning that the patient is healthy and he is recovering from the mild symptoms that he had of fever and cough. But clearly, the latest what we are gathering from the Indira Gandhi International Airport is that 3 more passengers have been tested positive and their samples have been sent to genome sequencing lab. Remember, Delhi government has itself two labs of the genome sequencing which can find out that whether it has a Omicron variant or not, and within 2 to 3 days the results will come. But the major worry of the national capital is that from the last 3 days, Delhi has recorded over 50 cases in 3 days in a row. Remember, on Friday it was 54 cases, on Saturday it was 51 cases, and in last 24 hours 63 cases have been reported, and positivity rate has been climbed to 0.11 percentage. But only as far as Omicron variant is concerned, only one case have been reported, and the patient has been told that he is now recovering from the disease.
Right, and as far as other measures are concerned, Aishwarya, as Delhi government, are they looking at any sort of stern measures now, restrictions? We do know that there is a high-level meet on this with top health ministry officials who will be meeting in the national capital today.
Well, as far as Delhi government is concerned, remember Arvind Kejriwal already had written a letter to Prime Minister that all the international flights from at-risk countries should be stopped as soon as possible, just because we know that all those people, 21 identified in the entire country, had a travel history from at-risk countries from Africa, and the flights have not been banned. So one of the issue has been already been raised. Delhi government, on the other side, is taking major actions, and a high-level meet has also been called with all the district magistrates of the national capital, and also with the Delhi Health Minister Satyendra Jain, to identify that whether there is a need of more beds or oxygen's availability at the LNGP hospital. But Satyendra Jain yesterday clearly mentioned that we have already occupied two major blocks of the LNGP hospital, which has been dedicated to Omicron variant, and sufficient number of health staff is also available. There is no need to bifurcate separately of what the earlier COVID-19 measures were, just because it is the same kind of disease. Nothing has been changed. People has to follow all those norms and regulations which have been prescribed by the Delhi government. But it has to be seen, when there are a rise in number of cases, what major steps Delhi government can take, either to shut down some of the major marketplaces which have emerged as which can emerge as a super spreader. Just because yesterday also we saw several pictures of the markets of Delhi where thousands of people have gathered without wearing masks and not following the social distancing. So this can be one of the steps that the Delhi Disaster Management Authority can take to shut down some of the markets which have been not following the guidelines as far as the Delhi government is concerned.
Okay, stay with us, Aishwarya. Let me rope in Abhijit Bhatt as well at this point from Gujarat. Abhijit, as far as Gujarat is concerned, is the government concerned with this new variant? Have they boosted their alertness? Has border controls been stepped up? What's the latest situation on ground there in Gujarat, Abhijit?
बिल्कुल, मैं बता दूं तो जिस तरह से जामनगर में एक केस सामने आया है ओमिक्रॉन वेरिएंट का पॉजिटिव केस, और उसके परिवार के 2 सदस्य भी कोरोना पॉजिटिव पाए गए हैं, तो इसके चलते राज्य सरकार सतर्क हो गई है। और राज्य सरकार ने भी जो दिशा निर्देश जारी किए उसके हिसाब से देखा जाए तो जितने भी लोग हैं जहां पर भी ऐसे मामले सामने आते हैं कोरोना पॉजिटिव केसेस आते हैं, जैसे कि पिछले कई दिनों से 20 से 22 तक कोरोना पॉजिटिव के केसेस आते थे, लेकिन पिछले 2-3 दिन से 45 से 48 तक आ रहे हो। तो पिछले 24 घंटे की बात करूं तो 45 कोरोना पॉजिटिव केसेस आए, जिसपे सबसे ज्यादा 17 केस अहमदाबाद में पाए गए और 2 केस जामनगर में पाए गए। तो जिस जगह पे जामनगर में 72 साल के जो बुजुर्ग आदमी है, जो जिसका ट्रैवल हिस्ट्री था, जिम्बाब्वे से आए थे, उनको ओमिक्रॉन पॉजिटिव पाया गया, उनके घर के 2 सदस्य भी पाए गए। तो जब आज जामनगर महापालिका के म्युनिसिपल कमिश्नर से बात हुई तो उन्होंने बताया कि उस घर में ट्यूशन क्लासेस चल रहे थे और बच्चों वहां पर ट्यूशन के लिए आते थे। तो 7 बच्चे को आइडेंटिफाई किया गया और सातों बच्चों को अभी होम आइसोलेशन किया गया और टेस्टिंग किया गया है, जबकि दूसरे बच्चों को भी आइडेंटिफाई करने की कोशिश जारी है महापालिका की। और इसके चलते राज्य सरकार भी सतर्क हो चुकी है, क्योंकि ये ट्यूशन क्लासेस चल रहे थे और वहां पर बच्चे जा रहे थे, तो उनको भी संक्रमण होने का डर लगा रहा है। और इसके चलते राज्य सरकार ने म्युनिसिपल कमिश्नर को भी आदेश जारी किया है कि स्वास्थ्य विभाग तुरंत इसके ऊपर एक्शन में आए और माइक्रो कंटेनमेंट जोन घोषित कर दिया है उस इलाके को। और जितने भी लोग वहां पे ओमिक्रॉन पॉजिटिव।
Okay, Abhijit, stay with us. Abhishek Sharma also is with us live at this point from Mumbai. Abhishek, if we talk about Maharashtra, the cases have been reported there already in Pimpri Chinwad and Pune. Now, Maharashtra has been bearing the brunt of COVID ever since the first wave. Is the state government concerned with this new spurt?
हाँ बिल्कुल, देखिए जाहिर सी बात होता है कि महाराष्ट्र में अब तक 8 केसेस मिल चुके हैं कोविड के। जो नया वेरिएंट आया है ओमिक्रॉन का, उसको 8 केसेस मिल चुके हैं। एक मिला डोंबिवली में, 6 मिले हैं पिंपरी चिंचवड़ में, एक मिला है पुणे में। टोटल मिला के 8 केसेस हो चुके हैं। लेकिन संख्या इसकी बढ़ सकती है क्योंकि 30 से अधिक जैसे और भी जो पॉजिटिव केसेस के हैं उनको जीनोम सीक्वेंसिंग के लिए भेजा गया है ताकि उसका रिजल्ट आएगा जल्द से जल्द, तब समझ में आ जाएगा कि क्या केसेस और बढ़े हैं। लेकिन ये बात तो साफ हो चुकी है कि महाराष्ट्र के जितने भी केसेस मिले अब तक के देश में सबसे अधिक केसेस महाराष्ट्र में मिले हैं और यही कारण है कि महाराष्ट्र सरकार लगातार तमाम नियम बना चुकी है ताकि इस नियम का लोग पालन करें, ताकि फिर से कम लगातार न लगाना पड़े। हम इस वक्त मौजूद है एक ऐसे मार्केट में और जगह पर, यह मलाड का जगह है। मलाड एक बड़ी मार्केट कही जाती है। उस मलाड मार्केट में आप देखिए कि भारी संख्या में यहाँ पे भीड़ होती है और भीड़ के वजह से कहीं पर भी कोई ऐसी गड़बड़ी ना हो, क्योंकि लगातार सरकार ने साफ साफ कहा है मार्केट से लेकर हर किसी को, कोई भी अगर शॉप पे जाता है, दुकानों में जाता है या फिर टैक्सी में बैठता है तो हर किसी को मास्क लगाना काफी कंपल्सरी होगा। अगर मास्क नहीं लगाता है तो उन्हें फाइन भरना पड़ेगा और साथ ही साथ अगर हैबिचुअल है तो वो फाइन की संख्या जो रेट है यानी जो चार्जेस है बहुत ज्यादा है। आप यहाँ पे देख सकते हैं भीड़ यहाँ पर है और भीड़ जरूर है, लेकिन भीड़ के अलावा हर कोई यहाँ मास्क लगाया हुआ है और ये मास्क लगाना ही हर किसी के लिए बहुत जरूरी है। अगर मास्क लोग लगाते हैं तो जो ये बड़ी आपदा फिर से एक नया दुश्मन आया है लोगों के बीच में, वो उससे बच सकते हैं। लोग इनसे जान लेते हैं। क्या कहेंगे, आप धंधा करते हैं, मास्क लगाना जरूरी है, लोग सबको बोलते हैं आप लोग?
हाँ जरूर बोलते।
तो बहुत लोग ऐसे आते हैं जो बिना मास्क वाले भी
आते हैं लेकिन उनको बोलते हैं कि मास्क लगाइए, मास्क लगाइए।
तो आपको क्या डर लग रहा है जो नया वाला एक आया हुआ है?
हाँ तो डर तो है ही है, सब डर तो है ही।
लोगों को समझाते हैं।
हाँ,
आप देखें कुछ और लोग और भी है। क्या आप देखें सब यहाँ पे रोड पे जो धंधा करते हैं ये लोग हैं, क्या कहेंगे दिनचर्या आपकी चल सके तो इसके लिए नियम का पालन करेंगे आप लोग?
जी नियम का पालन करेंगे।
तो आपके पास आते होंगे दुकान पे सामान खरीदने, तो उनको भी बताते हैं आप लोग?
जी जो मास्क नहीं लगा रहे थे उनको बताते हैं कि मास्क लगा लो, नहीं तो आप नहीं लगाओगे तो आपको फाइन भी भरना पड़ेगा।
और आप फाइन आपको ही भरना पड़ेगा?
जी
दोनों लोगों को भरना पड़ेगा।
जी जो मास्क नहीं लगा तो उन लोग को बोलते हैं।
बिल्कुल, आप देख रहे हैं और लोग यहाँ पर हैं। क्या कहेंगे, आप लोग यहाँ पे धंधा करते हैं या कैसे आप लोग अभी कैसे देख रहे हैं? क्योंकि वो समय देखा है आपने कि किस तरीके से लॉकडाउन लगा था, धंधा चौपट हो गया था, और आप कैसे देख रहे हैं?
सर अभी मैं बोल रहा हूँ जो नया वायरस आया अभी ओमिक्रॉन करके, उसमें हम लोग सावचेती तो बरत रहे। हमने दुकान के बाहर बोर्ड भी लगा लिया, मास्क लगा के आइए, सैनिटाइजर के भी बंदोबस्त कर लिया है और हम लोग अभी उसको बहुत अच्छे ढंग से ले रहे कि भाई कुछ गड़बड़ नहीं हो जाए। और ये महाराष्ट्र गवर्नमेंट जो हमारी है उधर सर जी वो भी काम अच्छा करे, उन्होंने भी लगभग पूरी तैयारी करके रखी है। इसके लिए हमको इतना डर भी नहीं है कि हम लोग।
लेकिन आपको तो कम से कम मास्क लगाना होगा। लोगों को दुकानों में जो आ रहे हैं
मास्क लगा रहे, हम लोग सैनिटाइजर का प्रयोग कर रहे हैं। गिराक को भी बोल रहे मास्क लगा के निकलो। कोई रास्ते पे जा रहा आदमी उसको भी बोला भाई साहब जरा मास्क लगा के निकलिए, आप ऐसा मत निकलिए, तकलीफ में आ जाओगे सब। कारण वो जो पहले की तकलीफ देखी हुई है उससे अभी थोड़े उभरे थे तो वापस ये नया वायरस आ गया, तो हम लोग को भी डर लग रहा है कि कब कुछ अकस्मात हो नहीं जावे। और हम नहीं चाह रहे कि लॉकडाउन लगे वापस, कारण वो लॉकडाउन में जो भुगता है ना हमने, अभी तक आंखों में से आंसू आ रहे हैं हमारी।
बिल्कुल बिल्कुल, यह समझ सकता हूँ कि दुकान पे आप जो देख रहे हैं इस वक्त यहाँ पे होता है कि जो भीड़ यहाँ पर है पूरा सन्नाटा छा रहता था, जो यहाँ पे हजारों की संख्या में इस वक्त भीड़ है। लेकिन यह लगातार तस्वीरें जो बता रही हैं मुंबई में कि लोग सजग हैं। कई जगहों पे देखने को ऐसा मिलता है कि कई जो लोग मास्क नहीं लगाए जाते, लेकिन आपको तस्वीरें दिखा रहा हूँ, यहाँ पे लाइव तस्वीर देख रहे हैं। मुंबई का मलाड का इलाका, नटराज मार्केट अपने आप पे बड़ा मार्केट कहा जाता है। जो लोग भी यहाँ पे मौजूद है सभी के सभी लोग यहाँ पर मास्क लगाए हैं और एक अच्छी बात है, और अच्छी बात है मास्क लगाना। क्या कहेंगे माता जी, नया वायरस आया उससे कितने आप मास्क हटा के लगाया आपने? बाहर निकलती हैं मास्क लगाती हैं आप लोग, सबको बोलती हैं?
हाँ, जो नहीं लगाए उनको समझा के बोलती है और हर नागरिक का ये कर्तव्य है कि मास्क कंपलसरी लगाना मांगता है। मैंने तो देखो मास्क भी लगाया, ऊपर से दुपट्टा भी लपेट दिया, बाल भी ये नहीं होना चाहिए करके बाल भी बांध दिए।
सेफ्टी आपने पूरा सेफ्टी रखा हुआ है
जी,
क्योंकि अभी हम लोग की एज है, हम अपने आप को हम संभालना चाहिए, तो ये सब ठीक ठाक हो जाएगा। फिर से हमारा पहले जैसा समृद्ध देश हो जाएगा।
बिल्कुल, बहुत अच्छी बात है, बहुत अच्छी बात है। यह समाज यही वजह है कि हर कोई अगर सच में इस नियम का पालन करे तो बिल्कुल कोरोना को मात दे सकते हैं। लेकिन जरूरत है हर किसी को सजग रहने की, जैसा कि आप देख रहे हैं इस वक्त। लेकिन मुंबई में इस वक्त ओमिक्रॉन के 8 केसेस मिल चुके हैं, संख्या बढ़ सकती है। देश में जो अब तक 12 से अधिक केसेस मिले हैं, उसमें सबसे अधिक महाराष्ट्र में 8 केसेस मिले हैं उदय ओमिक्रॉन के।
जी बिल्कुल, बने रहिए आप हमारे संग अभिषेक। हमारे संग कुछ मेहमान भी इस वक्त जुड़ रहे हैं। डॉक्टर MC मिश्रा, फॉर्मर डायरेक्टर एम्स, इज लाइव विद अस। वी आल्सो हैव डॉक्टर PSP Rao, consultant surgeon, Columbia Asia Hospital, Hebbal, Bengaluru, joining us live. Padma Shri Professor Mohsin Wali, cardiologist and physician, is also with us on the broadcast. Dr. Mishra, let me begin with you first. As far as the Omicron variant is concerned, sir, it seems to be spreading with frequent pace. Is this concerning? Should our alarm bells be ringing immediately?
Yes, why not? Alarm bell should ring, but panic should not be there. As we know, not much about this virus so far, that what is its infectivity, on what basis people are saying that it is more infectious than Delta variant, because there has not been even a major outbreak in South Africa so far. There have been some incremental admissions in the hospital, but there are no increased deaths. So mortality is still, we are waiting for more data to come from the countries where it has been reported first. India, what I feel that and suspect that whatever cases, number of cases we are mentioning in the media is just the tip of the iceberg. There might be many more. When genomic sequencing will be done in large numbers, then we will know that this variant has been there for quite some time, not that it has suddenly come imported recently. Because there are a lot of people in this weather, particularly when November starts, October and November starts, there are a lot of people who have upper respiratory tract infection. So I think we'll have to wait for more data to come in, our own also, because if you look at our number of infections per 24 hours, today morning it is around 8,000, and yesterday also it was the same number. Today, actually, it is a little bit less than yesterday. So we have not seen any dramatic increase in infections over last 24 hours.
Yes.
So I think next 2 weeks, 3 weeks would be very important to monitor the number of infections every 24 hours, because India was stabilizing around 8,000, 10,000. And that happened last time also. If you remember, in last February, March, almost it was the same 8,000, 10,000, but it did not sustain for that long. And then it started increasing. So that is where the caution needs to be exercised. And whatever was discussed by your reporters, I think people, this media coverage of Omicron is important from that perspective, that at least people will again start observing COVID appropriate behavior.
Okay, let me quickly bring in Dr. Wali as well at this point. Dr. Wali, as far as your reading of this variant is concerned, do you believe it is pretty severe, or is it milder than Delta? It seems to be spreading with the same kind of pace as Delta and other variants, but is it milder?
Well, good afternoon, and I would thank you for bringing me in. Your reporters have done a fantastic job, and so are some speakers from the crowd which they have spotted, and I'm very happy listening to them. Really, this is what is the need of the hour, and I fully agree with Dr. MC Mishra at his point where he said that it is tip of an iceberg. Yes, it depends on how many genome sequencing we are doing out of spotting RT-PCR positive cases, which must be leaving around 30% cases. So we have to be careful. The explanation, my explanation for this sounding milder in lethality and stronger in infectiousness is very simple, that it has large number of mutations. Out of 50, around 30 at the spike protein, S protein, and there are other significant mutations which are not very academic concern of the public. So there are like a domain of the N-terminal and others, and leucine to the other amino acid, things like that. But most important point I want to make is that the larger number of variations in amino acid sequence, as has been proved in one study in Israel, by a very important scientist who is a virologist, they are fighting amongst themselves, and the net output of lethality is getting lesser, and this phenomena he has named as epistasis. So virus is static within itself despite large number of mutation, and this probably explains the mild lethality, but that does not leave us from the memory of delta which is around. We are forgetting that delta is around, and over and above we are getting a new one. So we should not forget delta is around. We are talking of Omicron. Everybody in the world is talking about Omicron and forgetting delta and worrying about...
You're right. The fact is that there is a new variant, but that doesn't mean the old variants have disappeared.
Larger enemy has not vanished completely.
Yes, Dr. Rao, does that mean then that we need to seriously think about this booster dose proactively?
Yes.
Dr. Rao?
We have to.
Okay. I think we've lost Dr. Rao there, unfortunately. Yes, Dr. Wali, quickly,
Can
sir.
you hear me?
Rao, you are muted.
Yeah, can you hear me now?
Quickly, Dr. Wali, I have to end then. I've run out completely out.
So we need to give a booster dose because most of us have received our vaccine in January, February, the doctors, plus all the high morbidity patients have received it a long time back. And it has been shown worldwide that after in about 6 months, the efficacy starts coming down for most of the vaccines. So it is a good idea to start using the booster. Doesn't mean that we ignore the people who have not had even the first dose or the second dose. Yesterday's statistics shows that 50% of the adult population of India has now had 2 doses. And if you look at other virus vaccines, usually 3 doses are needed. So we should continue to get rest of the population vaccinated, look into the children's vaccination, and meanwhile give a booster to those people who have taken their dose earlier. As far as this Omicron is concerned, yesterday the National Institute of Virology in Pune has received the sample. They have started isolating the Omicron variant and multiplying it. Once they multiply it, then they will be able to test and tell us how effective or less effective will the vaccines be against it, and those who have already been infected. We shouldn't panic, like Dr. Mishra said. We need to be only concerned about the precautionary measures which are effective against any kind of viral variant. So we should continue with masking and with effective masks. It should be N95 is the most effective mask. If you don't have that, at least any kind of mask is better than no mask. Any kind of vaccine is better than no vaccine.